I'd like to discuss 10 practical tips for healthcare providers to prevent chronic Lyme disease. This is part of my common sense Lyme disease discussion. I take information that I see in my practice, that I use in my practice, and present a summary. In this case, I'd like to begin with Lyme disease as a clinical diagnosis. If we could just get away from blood tests as being confirmatory and necessary in order to treat, that will prevent a lot of chronic Lyme disease, acute Lyme disease, complex situations. Early treatment prevents co-infections, so I find it's very important to not tie yourself down to a rigid tick bite, a rigid rash, or require a bullseye rash. Over half the rashes are flat red anyway. And there's some rashes that are atypical, that are blistering or deep purple, that require a broader diagnostic workup, but could end up being Lyme disease. The next, number 3 tip is to be aware of co-infections. So even though you're treating Lyme disease based on the pathways that were discussed in the 70s for Lyme, there have been a lot of co-infections that have arisen over the years. Anaplasmosis interlichia can be treated with rifampin. Babesia is probably the most interesting one because it's a parasite in the red blood cells, and that parasite needs treatment for babesia with a parasite medicine called 𝐒𝐒𝐑𝐈𝐏𝐍𝐿. It's marketed as Mepron or Malarone. Lyme disease mimics other conditions, so if you're just aware that whatever the diagnosis is, there could be another diagnosis underneath it, but if it's Lyme disease causing it, I wouldn't get held up in a chart and held up with the diagnosis without questioning whether Lyme disease is a factor. Next is that seronegative Lyme disease exists. From the very beginning, they knew that people had negative tests. The only reason the CDC criteria came up with a test was they anticipated that people would be taking the vaccine, would get a positive test from the vaccine. It was meant for surveillance definition. It left off some important markers on the Western blot. For some reason, some doctors continue to use it for a clinical diagnosis rather than use their clinical judgment, and that's going to miss cases that are important to treat. Post-treatment Lyme disease syndrome has been proposed instead of chronic Lyme disease. I'm not interested in that diagnosis, or at least not excited, because people have called it a syndrome without considering that there's a persistent infection that might be underneath this illness. Number 7, tick prevention is key. So even before getting infected, if there's a way to get the tick off, be careful not to squeeze the tick. Also, try to avoid tick-borne areas, and if you come in, put your clothes in a dryer to try to knock off the ticks or kill the ticks. Be careful in the house. I tend to vacuum with a dust vac the chairs that dogs sit in. I prefer that the dog not sleep in the bed, because even if the dog is treated, the tick might make its way over to you. Number 8 is a rash is not a strong indicator since it's gone half the time. And it's important to be looking for other criteria. Now, second last is that Lyme disease is spreading. So even though in the 70s, all the discussion was endemic areas, which is the Northeast, Michigan, Wisconsin, and maybe the California area, since that time, ticks have been moving. Ticks might have already been there, but they've been identified all across the United States. And also deer have moving, but more importantly, birds have been flying ticks back and forth. There was a big study of how many ticks were just carried to Canada. Millions of ticks were carried to Canada. And so those ticks come back with birds. And number 10, lastly, is that Lyme disease can affect multiple systems. So if you diagnose one condition like POTS, that's an autonomic issue. It could end up being Lyme disease. There are cases where dementia was discussed because of cognitive issues. Lyme disease is worth at least consideration. And then there's migraines. A lot of people with Lyme have head pressure over their sinuses, thought that was a migraine. and or thought it was a sinus infection. There's an endless amount of numbness and tingling cases where they might suspect plantar fasciitis, which is foot pain, but not realize that Lyme disease can cause that type of sensation. Gastroenterology issues are being worked up, but sometimes the autonomic nervous system creates nausea and constipation, sometimes diarrhea. So if one is aware of those 10 tips, it's amazing if you're a patient, if you're aware of the need to be evaluated, but particularly professionals who want to avoid chronic Lyme disease or recognizing chronic Lyme disease so they can intervene. These tips are what I always advise considering, and they're all current tips that can be used as we speak today. In summary, chronic Lyme disease can be prevented with early action. Healthcare providers are important. Drop your thoughts in the comments. And thank you for participating in this common sense Lyme disease that's based on my practice, based on what I've read, and based on working with colleagues in the field. Thank you for participating. Have a good day.